Functionality was added to the medication history request option to include pharmacy fill data. This allows providers to view patients' medication fill data from the pharmacy, including the last fill date and the SIG or directions. To distinguish between pharmacy and claim data, new columns and drop-down options were added. No additional setup is needed to view pharmacy fill data, as long as the provider is already enrolled in medication history. Let's take a look at this in the application. With NextGen Enterprise EHR open to a patient chart, click the Medications button. The Medication History button was previously disabled if the patient did not have RX eligibility. Now the button is always enabled and is not dependent on RX eligibility. Although RX eligibility is not needed for medication history pharmacy fill data, it's recommended to run eligibility prior to clicking the Medication History button. This is recommended in case the patient has an active pharmacy benefit manager, or PBM, so you can retrieve the claim data in addition to the pharmacy fill data. Click RX eligibility. The patient's eligibility displays here. Click Medication History. If medication history consent is not up to date, you'll need to complete it before requesting the medication history. All med history is selected by default and can display a few different options. If no information is retrieved, medication not found, or no claim or pharmacy fill data is available will display. If you just see pharmacy fill data, that means there were no claims reported to the patient's PBM, or they don't have any active PBM coverage. If you see a combination of both claim and pharmacy fill data, the patient has medication claim data submitted to their active PBM along with pharmacy fill data. A combination of both displays here and is sorted alphabetically with the most recent claims data first. If claim data has the same drug name, dose, strength as other data, it displays after the most recent pharmacy fill data for the same drug. The source column displays the type of medication history. It will display claim for PBM fill data and pharmacy for pharmacy fill data. The last fill date displays the most recent last fill or dispense date. The sorting functionality on the column headers was removed. Let's take a look at just the pharmacy fill data. Click the drop-down arrow. Select Pharmacy. The pharmacy fill data displays by most recent last fill date and may contain the SIG. Remember, pharmacy fill data does not require RX eligibility or active PBM prescription coverage. The fill data comes from the pharmacy that filled the prescription and includes medications that were paid for by a patient's PBM along with other payment methods such as a coupon. Click the drop-down arrow. Select PBMF. The claim fill data displays as it previously did by displaying PBM claims by most recent last fill date and does not contain the SIG. To open clinical reconciliation, click here. Here you can see the claim and pharmacy fill data. Click the pharmacy fill data. No changes have been made to importing pharmacy fill data within clinical reconciliation. Click the full view. The data displays here. To close clinical reconciliation, click here. You should now know how to use the medication history component to view pharmacy fill data via SureScripts.